So thank you to thanks very much to those of you who filled in our survey. We're going to go through some of the results around that, but people haven't seen it. We did a short winter survey asking a few key questions. We're going to post the link in chat if you haven't filled it in. Please still do it. We're going to keep this open for a little bit of time because actually we'd quite like to. We'd like to use it to get it to a level where we've had a higher response, a slightly higher response, so that we've got enough information to use it to try and use it as a bit of leverage locally for something you might be able to use in your discussions with senior leaders in your organisations to help plan for winter next year, basically. So yeah, we so far we've got 19 responses. It's almost 50-50 split between local authorities and NHS ICBs and one provider trust. Next slide, please. So the first question was around when was your budget confirmed for winter communications? And you can see here that for a lot of the people who responded, no budget at all was allocated. Now, most of those responses were in local authorities. So it does seem that particularly winter pressure funding is more of an NHS thing and an NHS priority. But I'm sure lots of local authorities will still have been doing things like, warm rooms and that sort of thing, as well as the cost of living stuff, particularly over winter. So maybe it's just described a little bit differently in local authorities. But so out of those who were allocated a budget, a few lucky people had that allocated in sort of March and April. July and August, again, that's a good lead-in time to plan for winter. But then the majority had their budgets confirmed in September and October, which I would argue quite strongly isn't enough time really to plan effectively. So then we asked the question, when would you like your budget to be confirmed? And you can see a clear difference there in the results. So, people would like it, the majority of people would like it either March, April or May or June. Probably a lot of those who've had it even later would like it in July and August. But, people want their budgets confirmed earlier. So, yeah, that's, if we move on, please. Then we asked how joined up public health communications have been this winter. And the good news with this was that nobody so far has chosen not joined up at all, which is really good. You can't actually fully read that on this slide, so apologies. I'm going to tell you what this says now. Hang on, so one sec. So 9 people said selected some sharing of messages, and that's 45%. 7 people said coordination of messaging across the local authority and the ICB, and 4 people selected coordinated messages and activities shared by all health and care partners. So there's some good positive stories there, I think, in terms of how things have been joined up, and I think I guess the next step could be working even more closely and potentially looking at possibly pooling activities, planning together, sharing budgets potentially could be a way of increasing impact further. Next slide, please. So then we asked what were the main areas of focus for winter comms. Not going to read all of these, but you can see the one that probably a lot of us have worked on, which is winter vaccinations, using the right service, industrial actions up there, and then you've got access to services and the cost of living fuel stuff. Yeah, so no huge surprises there. Next slide, please. Apologies, this is a little difficult to read, but this was asking what worked well this winter. So building on the previous slide, there's a few comments around kind of coordination across partners being good. Signposting, some said worked well. Paying for, so boosting organic social media and paying for advertising. Making use of our partners, cascading messages that came through. Cost of living campaigns. Yeah, there's a few different things in there. One person has listed an increase of activity across their social media. It'd be interesting to know what they mean by that, whether activity is posting stuff or actually getting reach and engagement. But yeah, next slide, please. Let me ask what didn't work so well. So there's something around so negative comments around the industrial action that I'm sure lots of us saw that over time. We've got things like flooding came up actually, and which I know in some areas has been a big issue this winter, as it often is. Native reach, so organic posts on Facebook, that hasn't particularly worked for lots of people, and I can see why that would be the case. Confusion around cold weather alerts, budget allocations or lack of budget allocation, or budget coming in late is a clear trend. That's in there 4 or 5 or 6 times actually. So next one, please. So then we asked, what one thing have you learned this winter to help with planning for next? So there's one particularly around engagement with the public, seasonal timetable and planning ahead. Again, why we need our budgets identified early, involving clinicians, planning again, coordination, preventative comms, in both public health, in local authorities and in the NHS, we always talk about prevention being one of our biggest priorities, but actually we often end up reacting too much, and it's really hard to be strategic in terms of how we plan ahead and make real impact in terms of lots of the areas where we know prevention will make impact, because it's that slow burner. You don't see the results until much further down the line. So some people had valuable insight from communities. Again, it would be good to think about how we might share some of that, amongst organisations, and planning again, evaluation. Yeah, that's the gist of that one.